Vanakkam, good morning. In this video, we are going to discuss about the erythrocyte sedimentation rate. Erythrocyte sedimentation rate is the rate of falling of RBC in expressed in the millimeter per hour. If you keep the blood in the vertical tube, that is erythrocyte sedimentation rate. ESR test routinely do in the hospital for assess the patient. ESR is called as the prognostic indicator. Prognosis means assess the progression of the disease, whether the disease will cure easily or it will take long time. We can assess by the prognostic indicator. Diagnosis means detect the disease, but the ESR is the mainly a prognostic indicator. So ESR was first demonstrated by the Edmund Bernanke in 1897. So it is also called as the Edmund Bernanke reaction. What are the factors affecting the ESR? The Rouleau formation. Rouleau formation, if you keep the blood in the vertical tube, the one cells are pile up over the another cells like stack of coins, one coin over the another coin, forms the Rouleau formation. So this is the Rouleau formation. It is looking like stack of coins. This is one of the important factor for affecting the ESR. And shape and number of the red cells. If the larger shape means ESR will settle easily. The number of the red cells is less means easily cells are fell down in the vertical tube. And plasma factors, plasma protein also facilitate the ESR settling rate of the red blood cells. And fibrinogen also increases the ESR. And acute phase reactant, it is produced during the inflammatory conditions like C-reactive protein. These are also affecting the ESR. Other factors affecting ESRs are C-reactive protein, it is produced during the inflammatory conditions, and globulin also increases the ESR. And temperature, increase the temperature, the falling rate is more compared to the degrees temperature. And viscosity, the less viscosity, ESR is settling rate is more. More viscosity means ESR is decreases. The Westergren method routinely do in our lab. This is the more accurate method. The Westergren method, the male ESR is 3 to 5 millimeter per hour. The female 0 to 20 millimeter per hour. Females are giving the more ESR due to the females are having the less number of the RBC compared to the males. So this is the Westergren tube. It is the longest tube, 300 millimeter length. Both ends are open. So we have to take the blood up to the 0 mark. There is marking from 0 to 200 downwards. 0 to 200. So we have to take the blood from the to 0 marks. We have to keep it for the 1 hour. So we have to assess the settling rate of the ESR, RBC. So in the male it is only settled normally 3 to 5 mm. The female 0 to 20 millimeter per hour. Another one method is the Wintrobe method. This method is not routinely used for the measuring the ESR. This method is mainly used for the measuring the packed cell volume. The Wintrobe method, ESR is 0 to 3 mm per hour. Female is 0 to 20 mm per hour. This is the Wintrobe tube. This is the total length of the tube is 110 millimeter. So we can do both ESR and PCB with the same tube. So on the ESR side, the two types of reading for the ESR 0 to 10 marking is present in the downwards. Another side for PCB 0 to 10 marking in upwards. So we can do both ESR PCB with the help of Wintrobe's tube. But Westergren method is more accurate because we can measure for the up to 2 hours by the Westergren method. What are the physiological conditions affect the ESR? The pregnancy ESR is increased because the pregnancy hemodilution occur, and the menstruation also ESR is increased due to the loss of the RBC. Parturition also ESR is little more due to the loss of RBC. Gender, females are having the more ESR compared to the males because of the less number of the RBCs. Females are having less number compared to the males. What are the pathological conditions increases the ESR? Tuberculosis. Tuberculosis ESR is increased very much, and inflammatory conditions and malignancy and anemia. These conditions ESR is increased. What are the condition decreases the ESR? In the polycythemia, so viscosity is more in the polycythemia, so ESR is very less because of the settling rate is very high, very slow. Sickle cell anemia also ESR is very less due to the shape of the cell is altered, so settling rate is very slow. Like that, hereditary spherocytosis also shape of the cell is vary, so settling rate is very slow. ESR is the important prognostic indicator. It is done by the Westergren method. Another one method is the Wintrobe method. ESR is affected by the rouleau formation, fibrinogen, globulin, temperature, and viscosity of the blood. It is increased in conditions like tuberculosis, inflammation, malignancy. ESR is decreased in polycythemia, hereditary spherocytosis, sickle cell anemia. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe.